The next test that we do is X-ray, and this gives us significant insight into the problem inside of the spine and how much we have to correct. I'm going to refer to this chart right up here. You don't have to come with me, you can stay in that seat, but you'll notice that from the side, the spine has specific curvatures within it that are normal. The ears line up with the shoulders and the hips just like your posture scan, but inside of the spine there are curves. And the reason that this is important is because when the curves change from being normal to something other than normal, it increases stress on the spinal cord. So if we look over at the normal curvature in the neck, it's shaped like a banana. Problems that develop in the spine always cause the spine to straighten like this red line, and we lose this curvature. That means that if you were to take a banana and straighten it, it breaks. It breaks because the space of the shell becomes smaller, and now the spinal cord is always under some tension. So here, in this case, this spinal cord is under tension, this is normal, and it's not under tension. If we don't correct this, and time goes on, cells start dying in the spine because of the abnormal function and stress on the nerves, and we get deterioration. Our cells start dying inside of the spine. And here you can see the bones become pointed in shape and the space becomes less between them, or the disc. So we get this advancing degenerative condition, which is a continuum that happens over time as long as you have the problem. Some people interpret this as age, but it's not. It's a problem over time. So looking at these pictures, we're now going to show you your X-ray, and you can sort of pick and tell me what phase you think you're in. Okay? The first picture of your X-ray looks like this, and the blue line is the normal curvature. You're the red line. Does that look like the blue line?
No.
No. It's not only straight, but it seems like it's gone past straight. Can you see that? If we were to take a ruler and take the bottom 3 segments and create a straight line, it's actually gone further forward than straight.
Yeah.
So that means that your spinal cord has some tension in the neck region here, okay? And here's the back. You can see the skin of your neck, the nape of your neck, but on the inside your spine's going the opposite way. And we can't tell this just from a postural scan. We have to X-ray you. So I've measured your curve. It measures to be a 0-degree curve, which means that you've lost 100% of your normal curvature, and we need to correct this to remove tension off the cord. Does that make sense? Mm-hmm. Okay. The next picture is a picture of you from the front. So you're looking at yourself. This is your right side, the problem side, and this is your left. And the spine, again, is supposed to be perfectly vertical. But can you see how the skull is on an angle? We've drawn a line there to show you how the skull is held naturally for you, which is tilted to the right. And so we've drawn some lines in here to show you that the head tilts to the right, but then the spine bends back this way, and then again. So it's kind of leaning to the right, then the left, and the right again. Mm-hmm. So this just shows you more abnormality within the X-ray. And here, if you look at these red lines I've drawn on here, you can see that the shoulder to the neck is a short little curve, and the right side's a long curve. They're not symmetrical, okay? Can you see how that's not perfectly straight and you've got these abnormalities? Yeah. So it's not normal, and if we want to just not only get rid of your symptoms but get you as healthy as possible, this is something that can be corrected and needs to be corrected. And this is another picture of your X-ray with your mouth open. It just shows that your head is tilted again on the same angle and shows us a problem in the brainstem, and we know we have to get this corrected. And if you choose to do that, some time from now, we're going to re-X-ray you and compare the improvement from the care that we give you, okay? The last test that we did was the brain scan to measure your healing system's ability to alternate with your adapting system. And it works this way. These adapting system is regulated by a brainwave called beta, and the healing system is regulated by a brainwave called theta. It's not quite that simple, but we're simplifying it just to make the explanation. So when we look at your adapting system, which is beta, we look at all of these colors, which are the tests that we did to attract your attention. But in between those tests, we had you close your eyes and relax, and your attention gets shut off there a little bit when you close your eyes. But when we turn the test on and ask you to pay attention or subtract a number or listen to some sounds, your attentive or adapting system turns on. When you close your eyes, your adapting system turns off. So we get this pattern of on, off, on, off. We look down at your system. This is on, that's supposed to be off. Well, it is going off a little bit, so that's very good. This is on, that's supposed to be off. It is going off a little bit, so your adapting system is disengaging, and that allows the healing system to engage. So let's look at the healing system. That is theta. Theta is this brainwave, and theta is supposed to sit at 20%. That's sort of its readily state, so that if your brain needs to turn healing on, it can find it quickly and it's ready to go. If your measure turns out to be 16.17, not 20, so you're down 25%. Your healing system is a little lethargic and your brain has to work to find it, okay? That's one of the reasons that you have the problems that you do, the symptoms that you do right now. The other thing is that when we look at a normal functioning theta, when you have a test that's attracting your attention, it's off, but when you close your eyes and relax, turns on. If you have the test, your healing system turns off, but if you close your eyes and relax, it turns on. So unlike beta, we get this on, off, on pattern, off, on. So let's look at you. This is supposed to be off, that's supposed to be on. Is it turning on?
Oh, it's the opposite.
It's just the opposite. It's opposite in each one of these. So it shows that your healing system or your parasympathetics are not engaging in a stimulated in a strong way to turn your healing system on to an adequate or normal level. So we know that that has to improve, and that is changed through our adjustments to affect your prefrontal cortex. It's almost like reformat it so that this can change. And those findings are shown through this evidence called HRV, which is heart rate variability. Chiropractors are able to change your nervous system, and there's the evidence to show it. It's actually change your brain function, and this is the evidence to support that. This is a quotient called heart rate variability, and we use this because how well your brain changes your heart, whether it increases the strength of the contraction, the rate of the contraction, or the opposite, slows the strength and rate, based on your mind, what's going on in your mind. If your brain does a very good job of this, it's likely doing a good job everywhere else. So we use this as a general principle for how well your brain is regulating everything. This finding, very low, low, and high, shows a variation like a top hat, and that's a normal finding. When we look at your findings, it doesn't resemble exactly the top hat. It is low here, low with a couple high peaks, but this needs to improve. So we're going to give you an exercise to change this, and we're also going to adjust you. Our adjustments are going to change this as well. The exercise, we're going to have you refer to YouTube and to type in this person's name, WIMHOF. This is a breathing exercise that will change the function of your brain and nervous system. So let me just explain that, how that works. When you breathe in oxygen. Oxygen tells your brain you can live for a few more minutes, okay? That stimulates the adapting system. But when you breathe out, that's a relaxation phase. And when you relax, that stimulates the parasympathetics or the healing system. So your breathing influences both of these systems. The problem is that through evolution, these systems were always in a ready state and one wasn't dominant over the other, and our breathing helps keep them that way. But today, it's a lot different than it was over 100 years ago. Our attention is required many times throughout the day. It's almost constantly attentive. So our adapting or our sympathetic system has to stay on all the time, and it doesn't give the healing system a chance to turn on because it's always in the on position. So